groundbreaking event, not only for St. Luke's, but also the Philippines as well, to host the first of this such meeting in our country and in our hospital. My thanks also goes out to Hai Chongqing Haifu, who managed to put everything together with the expert organization of Miss Sarah who has been helping us with our HIFU installation and the conduct of treatments of HIFU in the country. We saw the technology of HIFU maybe 2 or 3 years ago during the pandemic, and we outright believed in that technology. It did take a while for the Philippines and for St. Luke's to get the first HIFU machine. But finally, we opened our doors February of 2023 to start the initial HIFU treatments in the country. And I can tell everyone in the audience and also those who are online that technology did not fail us. And I think it is something that is really going to be a standard of care, not only breaking new ground for minimally invasive treatment for uterine fibroids and myoma, but it's going to be groundbreaking and it's going to be trend setting for minimally invasive therapy. And that is what we want. That is what we endeavor to give the best care, the most comfortable care, and the most minimally invasive care to our patients. So you have a couple of days of intensive talks and workshops. And I welcome everyone who are here to our hospital. Our doors are open for you. Our facilities are open for you. And I also welcome everyone online to join us in this intensive learning activity for the next 2 days. Again, thank you very much, everybody.
So thank you, Dr. Serrano. So may we now call on Professor, the President of the International Society of Minimally Invasive and Virtual Surgery, Professor Philippe Descamps, to give his opening remarks.
Good morning, everybody. Thank you, Mr. President. Very nice introduction. So, dear colleagues, dear friends, it's really a privilege for me to be here today. As you know, I was past FIGO Vice President. I'm currently the President of this society, and I'm, of course, very happy to be here today. It's a privilege for me. It's my first time in Philippines, so it's also a great time for me. You know, this meeting is very important. We have a very exciting program, outstanding speakers, as you've seen on the paper. They are all experts in their fields, and they will present diverse topics from the fair amount of change in practice with salivary test in endometriosis, which will be my lecture, the next one, the first one of the morning. And the aim is to reduce surgery, then to robotic surgery, HIFU for adenomyosis and fibroids with or without infertility, vulvar and cervical diseases, liver cancer, plus learning curve and state of the art for HIFU. So you see, it will be a full day, fantastic topics and exciting speakers. You have to know that the HIFU focused ultrasound tumor therapeutic system is now available to patients in more than 32 countries and regions, and it has treated more than 280,000 patients with various benign and malignant tumors, as well as more than 1 million non-tumor disease around the world. So, you know, it's not an ongoing technology, it's a recognized technology, and it's an amazing change for patients. We all know, I'm a gynecologist, as you may know, so we're skipping from urology to gynecology, but the uterus is the cradle of life, and the promotion of minimally invasive and non-invasive technologies for the preservation of the organ integrity and function is paramount. So in this spirit, I welcome you to this event aimed at uplifting the well-being of patients suffering from endometriosis, uterine fibroids, adenomyosis, and cancers. May this be a time of learning and growth for us all. Enjoy the meeting. Thank you so much. Thank you.
So thank you, Professor. We will now start our regional conference, the strategies and advancements in minimally invasive and non-invasive surgery. So for our first session, the development of minimally invasive and non-invasive surgeries, may we now call on our session chair and moderator, Dr. Marie Cruz Javier. She is the Vice Chair for Administration at the Department of OBGYN and the Section Head of the Minimally Invasive Gynecologic and Robotic Surgery here at the St. Luke's Medical Center, Global City. Dr. Marie.
Thank you, Dr. Severino, for the introduction, and good morning to everyone. So it's an honor for me again to welcome the president of ISMIVS, Dr. Philippe Descamps. I don't think he needs further introduction. As we all know, he's the head of the ISMIVS and a FIGO vice president and the president of CNGOF, which is the Society for French College of OBGYN, and the vice president of SCGP, which is the Society of Gynecologists in France. I cannot pronounce what the acronym stands for. So let me welcome back on stage Dr. Philippe Descamps, who will lecture on this innovative approach in diagnosing pelvic endometriosis. His topic is entitled, "Will microRNA salivary diagnostic test reduce the number of laparoscopies for peritoneal endometriosis?" Let us all welcome back Dr. Descamps on the stage.
Click here and then here.
Thank you. Okay, so back. I will bring you in a journey of the future of medicine, and most of my activity is endometriosis surgery. But I've been working on a very exciting new project about the salivary diagnostic test. So I'm going to try to explain to you in 20 minutes what we did and where we're heading. So everybody here knows that endometriosis is a nightmare for women. It's 10% of women in their reproductive age. And we know that it's causing pain and infertility. And there are three subtypes: peritoneal, deep infiltrating endometriosis, and endometrioma. So the main problem with endometriosis, apart from surgery, which is difficult surgery, but the main problem is the delayed diagnosis. And as you know, in the world literature, it takes 7 to 10 years in average to reach the diagnosis. So it's a big issue. And 40% of the women will see 5 to 10 doctors, consultations, with MRI, with ultrasound, waiting for the results, trying a new treatment, and blah, blah. And 25% of all patients will have laparoscopy. So there was a very interesting paper published in 2022 in the New England Journal of Medicine trying to explain this. And as you see in this small video, the more you're waiting, the more severe is the disease with those deep infiltrating endometriosis that we all know and that we are treating every day. So the last international recommendations were issued in 2022. There were the HRA guidelines, and we started publishing in 2022. So of course, our tool is not it doesn't figure in those guidelines. So what is written is there's no, the clinicians are recommended to use MRI and ultrasound. But if it's negative, it doesn't mean you don't have a peritoneal disease. And this is the main issue. Of course, if you got a big cyst, if you got a big, deep infiltrating node, there's no problem with
Recording in
French
progress.
startup, which were specialized in NGS, new generation sequencing, and artificial intelligence. And those guys were not two young guys in a garage with a computer. They were already a company, working for big companies like Michelin, the tires, like Sanofi for research. So they had a recognition in this world. So we were a team of 3 centers in France, and we started working with them, and they were interested by endometriosis, understanding that it was a very important health issue. So we started understanding and talking about the microRNAs. Of course, I'm a surgeon, I'm not a biologist, and it was a new field for me, for us. And we started working on this. And from what I understood, is the microRNAs are used for translation between the messenger RNA and the protein. Remember the story of the messenger RNA and the vaccine COVID. Remember that the vaccine COVID was elaborated within less than 2 months, less than 60 days, and it saved millions of lives around the globe because of NGS and because of artificial intelligence. Otherwise, it would have taken many years. And so we started being interested by those microRNAs, and you see that you have several families, to be clear, to be simple. And the microRNAs belong to the family of the small non-coding RNAs, and there are others. So we worked on the micro, but you also have the pi, the SN, the SNN, so SNO, sorry. So maybe that in the next years we'll have papers and works on those RNAs, but we've been focusing on those microRNAs. So this story started in China. The very first publication came from Asia in 2013, so 11 years ago. And those pioneers published an analysis of 6 microRNAs, which were different in endometriosis patients. So, this was the real first step of the story. Of course, 11 years ago, those colleagues didn't have NGS, didn't have artificial intelligence. And this made a difference in our study. I'm going to show it to you. Then there was a very important paper in 2018 by Kavita Panir. Again, there's a few numbers of microRNAs were involved in endometriosis. And then a very important paper in 2020 in the American Journal. You see, this is only 4 years ago, and they were talking about 6, 8, 10 microRNAs. So what we did is a study, and with those 2 technologies of NGS and artificial intelligence, we pulled out from the blood 2,600 microRNAs. Imagine the difference. It was 6 and 8 or 10, and we pulled out 2,600 biomarkers with 86 biomarkers, which were different among endometriosis patients. So we said, okay, good news. It can be a diagnosis tool for endometriosis with a high score of sensitivity and specificity and an accuracy rate of more than 98%. So this was published, as I said, in 2022. We started in 2020 in Nature Scientific Reports. And while working on this, in 2021, we read this paper in the Einstein Journal, which I don't read every day, I confess. And the idea was, in the conclusion, they were writing that it might be of interest to study the saliva. And of course, we, the gynecologists, are not used to work on saliva. We are very good for pap smear, for uterine sampling, for biopsies, for whatever, but no idea of saliva. So when we read this article, we thought, wow, we could launch a new study with saliva and see what's happening. We had absolutely no idea of what would happen. So this is what we did. And this study was published in 2022 in the Journal of Clinical Medicine. And the news were very good, even better. As you remember, we had 86 biomarkers different in the blood. And in the saliva, we found 109 biomarkers, microRNAs, which were different in the blood, in the saliva. So this was, again, very, very interesting. It was 200 patients with a control group, of course. And of course, saliva is very simple, it's very reliable. And the good news is we performed study to study the stability of the saliva. And there's absolutely no change. You don't put the saliva in a fridge. You can send it by postal way, and it doesn't change. If the analysis is performed 1 day after, 1 week, 2 weeks, 3 weeks, all the same. So it's very interesting in terms of exploitations. We did conduct a medical economic study, which was published in the British Journal, showing that it's interesting for the society because you are avoiding laparoscopies. And then this was the first stone of the building, of course. We had to go further, and we launched another study, bigger study. At the beginning, we had 3 centers, 5 centers, and 18 centers in France, 14 months, and more than 1,000 studies. And we wanted to be sure that the results were as good as the preliminary studies. And we had a validation study, interim data, the 200 first patients of this 1,000 patient study. were analyzed by the New England Journal of Medicine Evidence, and they confirmed the validity of the test. This is very important because, as you know, the statistics are very important. And this study was very, very interesting. We had more stage 1, 2 than stage 3 and 4. Clinical symptoms were non-discriminatory compared to the control group. And 100% of the patients had laparoscopy, which is, of course, very important to give an answer for those patients. So the answer, the main conclusion of this study were that saliva are very good biomarkers, better than blood, which was, and we had exactly the same results as in the first study. So sequencing reproducibility. And the statistical validation was confirmed by the New England Evidence with a sensitivity of more than 95%, specificity more than 95%, and IUC more than 95%. So it became important and obvious that the results were better than what we had since now. So if you go back to this table, of course, it's better than surgery, better than MRI. So very interesting. And we performed also another study for fertility. In the first series of patients, we pulled out the infertile patients. There were 24% of our series that were infertile. And among them were 34 microRNAs, which were different. Among the 100 and something, there were 34 different for infertile patients. So it opens, a wide window of consideration for infertility and endometriosis. So now the indications. So yes, what I forgot to say is this 1,000 study we have the results. They are exactly the same and exactly as good. And they are now under review and they should be published very soon. So, okay, this is very interesting, but what do we do with this? And this is the title of this lecture, of course. So what we think today, it might change. Again, it has not been validated by ESHRE, it has not been validated by different societies, but what we think is that it could be interesting in those situations. So you have the patient, she has symptoms suggestive of endometriosis. You're not changing anything about your questionnaire, about your clinical examination, about your ultrasound and MRI. Okay, this is what we're doing every day. And then on the right side of the slide, you have a definitive endometriosis diagnosis because you have a deep infiltrating node, you have an endometrioma. So nothing is changing. You are referring the patient, you are treating her by either medical treatment, either RRT, either surgery. Nothing is changing. The interesting point is when you have nothing, and those patients are very confused because they've seen many doctors, they are suffering, they have pain, they had medical treatment, and they're still suffering. And they say, okay, ma'am, but the MRI is normal, so I cannot do anything. So for those patients, we think that it could be of interest to have the diagnosis by salivary test. If it's positive, then you can skip to the right side of the slide. You consider a treatment of endometriosis, you have the answer. So either you do a laparoscopy, then you have a medical treatment, whatever. And if it's negative, you can skip to other alternative therapeutics like alimentation, like psychotherapy, like anything And so it's very important for a patient to know, it's very difficult to say, I don't know what I have. I'm suffering, but I don't know. So it's very important. So we are working with the HAS. We are also working for HIFO in France with the HIS for reimbursement. We are in a socialized medicine. Everything is free in France, so everything is reimbursed. And they have been recognizing the value of the test, and they are launching a last study, which should be over at the end of this year. And the Minister of Health said that it will be reimbursed next year in 2025. As you might know, the politics is complicated in France today, so she will change, but we'll see. So to answer the question, shall we have, I'm sorry, can I have the previous one? Sorry. To answer the question, shall we decrease the number of laparoscopy for peritoneal endometriosis? Probably yes, if we use the test, because you have roughly, when you are performing a laparoscopy for a patient who has a normal MRI, normal, who is still suffering after treatment. You have, let's say, 50% of patients where you find something and 50% where you don't find something. So it should be in these cases that we avoid laparoscopy. Sorry. I did something wrong, I think. Yes, okay. And just to conclude this lecture, can we go beyond endometriosis? It's like HIFU, you know, HIFU is good for fibroids, but it's good for many other things. And beyond endometriosis, yes, we can, because this is what I call the microRNA revolution. I'm sure that you will be touched by this revolution in the next month or years in your practice. Why? Because, you know, the microRNA's functions are very important on metabolism, on invasion and migration, apoptosis, vasculogenesis, proliferation. So you immediately understand that it will be important for cancer, for neurology, autoimmune diseases. And when you go through the PubMed, the literature, you see nearly every week a paper about, you see gastric cancer, about pediatric multiple sclerosis, pulmonary arterial hypertension, everything. So it's like genetics. When genetics arrived, it was everywhere. And I'm sure that microRNAs will be everywhere. You see a paper published last year, exactly what we're doing. Salivary microRNAs as a non-invasive biomarker of hepatocellular carcinoma pilot study. So it's really interesting. And you see that in obstetrics, for example, you have papers now, potential biomarker. You see first trimester of pregnancy. You see that human term placenta. So it's really interesting in many fields, and I'm sure that our practice will change. And the next step, what is the next step? Well, the next step might be treatment of those microRNAs. So, okay, you put this on the table. We showed that the microRNAs are different. Okay, good news. 109 for saliva, for endometriosis patients. And maybe then we could treat them. And there are a few papers, not so many, but a few papers showing that it could be possible. And especially with this CRISPS system. And you see in very fundamental journals, they start working, the researchers start working on this. So maybe we could say, okay, you have such microRNA, which is different. We're going to change it, and then the disease will disappear. Of course, it's science fiction, but maybe it's for tomorrow. We see another very recent paper treating a microRNA 34A and with an anti-tumor efficacy. So I'm really sure that it will be important in oncology. And we launched a study for ovarian cancer. All the gynecologists know how difficult it is to treat, to deal with those ovarian cancers. And we are waiting for the results, which should arrive at the end of this year. So conclusions, I got 2 minutes left. So I'm on time. So this is the kit. It's very simple. You got a box, you got something to put the saliva in. It's really easy. And you shake 10 times and the patient can send it by post if she's far away from a medical center. So the conclusion, very important, is it's a non-invasive diagnosis test for endometriosis, but it's not a screening test. So there's no idea of having a screening. Let's say I'm 20 years old. My cousin who is 28 is suffering from endometriosis. I've got nothing, but I want to check. So no, this is not good. This is the nocebo effect, you know. Then this young lady, if she's positive, if she has nothing, will start to complain and problem. So it's not a screening tool, it's a diagnostic test. And as you've seen, the interim results of the external validation confirm the relevance of the signature with an accuracy rate of 95%, as well as specificity and sensitivity. So it looks very interesting. Of course, we're still working on it. It's not finished. At the end of we have we are launching different studies with different kind of patients. Will the Asian or African patients have the same results? We had only Caucasian patients. So will the adolescent have the same results? And shall we have the same result after treatment, for example? So it's very interesting. We had several awards in France and internationally, and we had the Galien Prize in France in 2022, but
We had the International Galen Prize in June in Roma, very recently, so it's very good news. We had the reward from the Surgery Academy in France, Innovation Academy, and so on. So here we are. Thank you so much for your attention. Thank you very much.